disease of the cataracts. It refers to a blur in the lens of the eye, which is normally transparent, as if looking through a foggy lens, similar to looking through a cold window or fog. Cataracts frequently impact vision for a distance, making it difficult to read, drive a car, especially at night, or identify the expressions of friends' faces. Cataracts are far away and cause vision problems, but they rarely cause discomfort or pain. Most cases of cataract develop slowly and do not affect vision at first, but as the blurring progresses, the cataract begins to affect vision in the end. Strong lighting and glasses can help with vision problems, but when vision problems threaten to affect one's lifestyle, surgery becomes necessary. Fortunately, cataract removal is sometimes both safe and successful. Types of cataracts. Cataracts are divided into 3 categories. 1. Cataract in the nucleus. It forms in the center of the lens in the early stages, and because the lens changes how it is focused, a case of short-sightedness may develop, or there may be a temporary improvement in vision while reading, obviating the need for glasses, but unfortunately, this situation changes and disappears after a while because the lens begins to yellow. Gradually, the eyesight becomes increasingly hazy. In reality, even with the development and worsening of the cataract, the color of the lens may turn brown, making vision in dim light or driving a car at night a difficult and dangerous work, and extensive fading may make it difficult to distinguish between shades of blue and violet. 2. Cataract in the cortex. It starts as streaks of blurred dots on the outside of the lens cortical cortex. The cataract grows slowly, and the streaks spread towards the center, blocking light from entering the lens's center. The majority of people with this type of cataract feel dazzled. 3. Cataract subcapsular. It begins as a small clogged area directly beneath the capsula, i.e. the outer layer directly, and usually forms near the back of the lens, specifically in the path that light passes through on its way to the retina. This type of cataract impairs the ability to read in bright light and causes halos around light sources at night. Cataract signs and symptoms. Cataract disease usually develops slowly and without pain. At first, the blurring affects only a small part of the lens, and the patient is unaware of the changes in his vision. However, as time passes and the cataract grows larger, it causes blurring in a larger section of the lens, obstructing and distorting light passage. The damage is finally manifested as broad blurring or distortion of the picture via the lens. The visual impact of cataract disease. When a cataract forms and grows, the lens gets fuzzy, scattering light and causing the picture received on the retina to become blunt, resulting in vision blurring. Is the nucleus. The lens loses its softness and transparency as it ages, and it thickens. Water and protein fibers make up the majority of the lens. The protein fibers are organized in such a way that the lens is clear and light can travel through it freely. The structure of the lens deteriorates with age, and the protein fiber structure disintegrates. Intertwining happens when a piece of the fibers interlock with one another, resulting in hazy in small areas of the lens. Cataract signs and symptoms. Among the signs and symptoms are vision that is hazy, blurry, or dim. Night vision is becoming increasingly problematic. Light sensitivity. Light sources produce halo effects. The requirement for brighter lighting when reading or doing other tasks. Replace your eyeglasses or contact lenses on a regular basis. Pale or yellowish coloration. One eye has double vision. Sunlight may appear like a lamp to those with cataracts, and the light from an oncoming car may appear as very bright lights. Halos around light sources can make driving a car difficult to the point of being unsafe, and persons with cataracts may experience fatigued eyes from time to time. They may also blink more frequently to clear their vision. The look of the eye is unaffected by a cataract. Pain, redness, itching, and alertness in the eyes, as well as discharge from the eyes, are not signs or symptoms of cataracts, although they could indicate other eye issues. The cataract does not endanger the eye's health until it gets entirely white, at which point it is referred to as a mature cataract. Inflammation, pain, and a headache may result from this scenario. If the mature cataract is causing inflammation or pain, it must be removed. Cataract causes and risk factors. The cataract can affect one or both eyes, although it usually affects both eyes in the same way, unless it is the consequence of an injury or accident. The cataract can affect the entire lens or simply a portion of it. Light goes via the cornea, the pupil, and the lens when the eyes are working properly. The lens is thick in the center and thin at the edges, where tiny bands and fibers of strong tissue hold the lens in place. The lens directs light traveling through the cornea and pupil to the retina, which is a thin, smooth membrane found in the eyeball's inner back wall. The specific reason of the lens shift that occurs with aging is unknown to scientists. Damage generated by unstable molecules known as free radicals is one possibility. Free radicals are produced by smoking and exposure to UV rays, as well as by the lens' natural degradation over time. Protein fibers may also alter as a result. Risk factors for infection. The following factors raise the likelihood of acquiring cataracts. Age. Diabetes. Cataracts run in the family. Any previous eye injuries or infections. Eye operations. Taking corticosteroids on a regular basis. Excessive sunlight exposure. Ionizing radiation exposure. Smoking. Cataract disease complications. The following are examples of complications. Tears in the posterior capsule can occur at any time during cataract surgery due to the nature of the treatment. Macular edema cystic. Endophthalmitis, inflammation of the eyes. Hemorrhage of the vitreous. Retinal detachment. Remove the lens from the camera. Cataract diagnosis. The only method to tell if someone has cataracts is to do a series of eye exams, which include: a visual acuity test is performed. A slit lamp examination is required. A visual examination of the retina. Treatment for cataracts. The only effective treatment for cataract is surgery, which involves removing the hazy lens and replacing it with a new transparent lens. A cataract can sometimes be removed without the need for a new lens. In some circumstances, glasses or contact lenses can be used to correct vision. In most circumstances, cataract procedures are successful in 95% of the time. Since surgical technologies have improved and the dangers of cataract surgery have decreased, it is now suggested that cataract surgery be performed as soon as the cataract begins to compromise the affected person's quality of life or ability to carry out ordinary activities. Cataract surgery is normally done independently in each eye in clinics outside of hospitals under local anesthetic, and recovery is usually quick. On the night after the procedure, you can resume normal activities, and the day following the operation, you can drive your automobile after the examination. Cataracts cannot be cured or treated with medicines, food additives, sports, or optical devices. However, in the early stages of cataracts, when symptoms are mild, understanding the condition and demonstrating a willingness to adapt a lifestyle to it may help in overcoming some of its symptoms, and there are various steps that can be taken. It is done out by the patient on his own initiative, such as reading with a magnifying glass or changing the lighting in the home to assist offset the effects of cataracts. Preventing cataract disease. The key to early detection is a regular and routine eye examination. It is suggested that persons over the age of 65 have their eyes examined every 2 years. True, cataracts occur with age in the majority of instances, and there is no way to prevent them entirely, but there are techniques to slow or stop their progression. Among them are: quit smoking, provide sun protection, dealing with other health issues, Alternative medicine. Herbs cannot be used to treat cataracts.